Assalamualaikum and hi. In this video, my group and I will be presenting on Parkinson's disease. My name is Anit Sakina and I will first introduce to you about Parkinson's disease. Parkinson's disease is a degenerative disorder of the central nervous system that mainly affects the motor system. Our central nervous system consists of brain and spinal cord. It is named central nervous system because it integrates received information and influence the activity of bilateral symmetric animals, that is all multicellular animals except sponges, and radial symmetric animals like jellyfish. And the central nervous system consists majority of the nervous system. Moving on, individuals with Parkinson's disease have shorter lifespan than healthy individuals among the same age group. And it is stated that their symptoms usually develop around the age of 16 years old, and more likely the individuals are more likely to live after 10 and 20 years after the diagnosis. The symptoms will be explained further by the next presenter, and that is all from me. Thank you for listening.
Okay, thank you for the explanation just now. Okay, now Amira Izzuddin Bihazuki, want to explain more about the symptom Parkinson. So I want to explain the 5 symptoms. Okay, so let's go.
You can see 5 symptoms in this slides. First, I will explain about the tremor.
Tremor or shaking is a 70% with people Parkinson experience this, but these symptoms are less common in younger patients. Symptom is always target or more frequent at the hand, but sometimes it can be affect the other parts such as chin or the leg. So the resting tremor is always happen during resting movements such as sitting down. Next is rhythmic. Rhythmic means it occur gradually and do not execute sudden or shockingly. And the last is asymmetrical. Asymmetrical is they usually occur in one side of the body and within the area towards both sides of the body. I want to explain is a rigidity or the stiff is the one of the symptom of Parkinson, and it can cause that person become more pain and muscle cramp, and he become difficult to find movement such as writing or doing up a button, and he become more fatigued. And I want to add some point is facial masking. Facial masking is a problem in muscle in the face, and you can be hard to create a smile, or your raise your elbow is difficult to him. And when you want to express feeling using your face is difficult. That's a facial masking. Okay, the next point I want to explain is the speech change. The person have the PD, they undergoes to difficult to expression their thought into the speech, such as they are hard to find the right words, therefore concluding the slower speech. Okay, and there are 3 terms in associate these symptoms such as hypophonia, dysphoria, and tachypnea. Hypophonia you can refer to the abnormal reduced the volume voice due to weaker muscle, and the tachypnea is a rapid or mumble speech, or you know as a cluttering. And lastly, dysphoria. Dysphoria you can characterize the poor articulation of the phonemes, which are the one unit of the sound, and that distinguish the word from another particular language.
For the next slide, I will explain more about the slowness of movement. This symptom be detected easily during a task that require fine motor skill, where the person with PD are unable to fulfill the task on regular speed, unlike person without PD. Next noticeable feature is slower reaction in automatic movements such as blinking eyes. So we can detect the symptom in change in writing style, or they're called micrographia. The change can be detected as the writing becomes smaller and cramped. Lastly is postural instability. Postural instability tends to be a tendency to enable while standing, as Parkinson's disease affect the reflex required to sustain an upright posture. These motor symptoms can be enduring as the likely to fall increase. Therefore, worse injury can happen such as broken bones for someone who's developing postural instability. Pull test is used by doctor to test for postural instability. The test is simply just forcefully pushing the person's shoulder backward to analyze whether they are capable to give out a reflex response. Okay, that's all for me. Thank you for hear and watch my explanation. Now I will give the next presenter. Stay healthy and stay healthy.
Assalamualaikum and hi everyone, my name is Muhammad Firdaus bin Zulkifli and today I'm going to present about the 5 stages of Parkinson's disease. So, as we know that some elderly are unaware of the presence of Parkinson's disease because they assume that the symptoms of Parkinson's disease is just part of the aging process. So, to help them to know the severity of the symptoms and helps them to evaluate how far the disease has progressed, most doctors rely on the Howe-Yard rating scale for Parkinson's disease. This rating scale was published by Melvin Yard and Margaret Howe in 1967 in their Journal of Neurology, Parkinsonism, Onset, Progression, and Mortality. The Howe-Yard rating scale has 1 to 5 stages to rate the symptoms. For example, stage 1 to 2 is known as the early stage, where 2 to 3 is the mid stage, and lastly 4 to 5 is the advanced stages of Parkinson's disease. In the first stage of Parkinson's disease, the patient will have mild symptoms and occur so minimal or non-functional impairment and only occur in one side of the body. The patient will experience tremor and other movement troubles. For example, they will feel a sudden light shaking in either their right or left hand, and this will affect their face, posture, and walking. If the patient recognizes this as the early stage of Parkinson's disease, they can reduce or minimize the symptoms by taking prescribed medications. Moving to the next stage, the symptoms are now getting a bit little worse, where the symptoms are now affecting both sides of the body, and the patient will experience a significant change in their facial expressions, tremor, trembling, and stiffness. But in this second stage, the patient will not experience impairment of balance, but they will have difficulties in speech, walking, and their posture. Usually, patient in stage 2 is able to live alone, but their daily tasks and routine might be disturbed because of the presence of the symptoms.
Moving to the third stage, which is the middle stage for Parkinson's disease, the patient has begun to experience more moderate disease because this stage is the major turning point of the progression.
The patient now will experience the loss of balance, slowness of movements, and decreased reflexes. This may cause the patient to often fall because of the instability, and they might find difficulties in doing their daily routine such as walking, eating, and dressing. But they can still able to live alone and do it independently. The symptoms in this stage can be decreased if the patient takes medications and occupational therapy. Moving to the fourth stage, which is the advanced stage of Parkinson's disease, the patient will now face a nightmare because they will be separated from their independent and the symptoms are getting severe and limiting. This is because the patient is starting to need assistance from someone else and they might also need assistive devices. It is clear that the patient is not able to live alone in this stage. Lastly, the final stage of Parkinson's disease is the most advanced and critical stage. This stage can be characterized by advanced stiffness that may cause the patient to feel freezing in the legs and making them to unable to walk or stand. Thus, the patient only have few options in this stage. They need a wheelchair or bedridden.
If the patient refuses those options, they might be having a difficult time such as falling for repeating times. Thus, they also need around-the-clock assistance by nurse for all activities. The patient also will have potential to experience hallucinations, confusions, and delusions.
That's all for me for the 5 stages of Parkinson's disease. Now I will pass the presentation to the next presenter.
Assalamualaikum and hi guys! My name is Noor Shinadra binti Muhammad Shakri and I'll be explaining the factors of Parkinson's disease. Parkinson's disease is caused by the damaged substantia nigra. But what really is the causes of a damaged substantia nigra? There are several factors for this to happen, such as genetic factors, the usage of illegal drugs, environmental factors, lifestyle, and also changes that occurs in the brain. Genotyping development has allowed researchers to conduct wide-scale assessments of genetic risk factors that is linked to Parkinson's disease, and there are at least 28 gene variants that has been found. If a person possesses one of the genes, it will not have a major effect, but if a person possesses a number of the genes, it will produce a major effect due to the cumulative effect of the genes. Next is the usage of illegal drugs. There was a case in Northern California in 1982 in which a number of young adults were taking a drug that is identical to heroin. Later on, they were showing symptoms of Parkinson's disease. This is because the substance damaged the neuron in which the neuron is unable to release a neurotransmitter called dopamine. If the neurotransmitter cannot be released, it will lead to the impairment of mitochondria from all over the body cell to travel to synapse. Moreover, the environmental factors such as being exposed to toxins and hazardous chemicals can also lead to Parkinson's disease. It is found that the risk of Parkinson's disease can be increased by being exposed to insecticides, herbicides, and fungicides. However, there are a number of cases that will increase the risk to certain people, even more after being exposed to these chemicals, such as those who possess the genes that are correlated to Parkinson's disease and also those who suffer serious head injury. Hence, it can be concluded that the combination of these factors will increase the risk even more. Furthermore, one lifestyle can also lead to Parkinson's disease. It has been proven by comparing the lifestyle of those who were diagnosed with Parkinson's disease and those who did not. Smoking cigarettes and drinking too much coffee are known to be an unhealthy habit. However, it was discovered that those who consistently smoke and drink coffee are less likely to be diagnosed with Parkinson's disease. However, consistently smoke and drinking too much coffee will bring other side effects and other chronic diseases such as lung cancer. Lastly, the factor that leads to Parkinson's disease is the changes that occur in the brain. One of it is the presence of Lewy bodies, a microscopic marker of Parkinson's disease that is composed of specific substances that have been clumped together within brain cells. It is one of the crucial clues to the risk of developing Parkinson's disease. Next, a substance that exists within the Lewy bodies, which is a natural and widespread protein known as alpha-synuclein. What concerns the researcher is that alpha-synuclein is a protein that is clumped together in which the human body does not have the capability to break it down. Hence, researchers are still studying the alpha-synuclein and how it leads to Parkinson's disease.
Hi, my name is Fatin Amira Binti Fuad, and now I will tell you guys about the effects of Parkinson's disease. So the first effect is anxiety and depression. When living with a chronic condition such as Parkinson's disease, usually patients will feel anxious or disappointed, then lead them to depression. And most of Parkinson's patients are dealing with depression as structural and biochemical changes happen and lead to behavior manifestation. One of the hormones is serotonin, which regulates moods, are affected because of the disease. The second effect is difficulties in swallowing and chewing. So Parkinson's disease also weakens the muscles in patients' mouths, jaw, and lead to difficulties for chewing and swallowing, especially during the late stage of disease. This happens due to changes in function either in the autonomic nervous system or the muscles in the throat known as the pharyngeal muscles. The third effect is sexual dysfunction. It is common for Parkinson's patient to experience drops in sexual ability or drive. The drop in sexual desire and physical functioning happens because of the reduction of the dopamine level. Parkinson's disease damage the nerve that enable men to have erections, and then for female patients, problem with vaginal dryness can happen. Anxiety or depression, also fatigues that experienced by the patient, can also cause changes in behavior attitude, and the patient will no longer enjoy the sexual activities. The fourth effect is dementia. Some factors can give a high risk of dementia, such as severity of the motor disorder, depression, and the family history of the dementia. Several signs that show a person is having dementia is difficulty remember things, trouble concentrating, poor judgment, and irritability. And the most common dementia in Parkinson's disease is dementia with Lewy body. The next is sleep disorder. Sleep problems may be an early sign of Parkinson's disease, even though before motor symptoms occur. And some issues that might be having by the patients is insomnia or having nightmares, REM sleep behavior disorder, nocturia, also restless leg syndromes. And this will disrupt the patient from having a proper sleep and proper rest. And the next is speaking problem. Most individuals who's living with Parkinson's disease have speech problem. As this disease affected muscles, speech can become softer and harder to understand, and speaking will become difficult over time. Trouble of begin speech, distorted voices, rapid speech, or imprecise articulations are the most common recorded issues with speech among the patient. The last one is involuntary movement, or known as dyskinesia. This condition is not caused by the disease of Parkinson's, but by the drugs they use to treat it. Dyskinesia is muscle movement which cannot be regulated by the people with Parkinson's disease. For most of the day, patients can have dyskinesia, and some may feel it just after taking their medications, or some may feel it before the next dose is due. And that's all for me. The presentation will be continued by Alisa. Thank you.
Hello, my name is Nur Alisa Sharina, and I will be presenting about the treatment or recommendation for Parkinson's disease. So, there is no specific medication for Parkinson's disease. Basically, Parkinson's disease have treatment based on the patient's symptom, including medication and surgical therapy. Nowadays, there is a lot of way to treat the Parkinson's symptom. So the treatment include prescription medication, surgical, medical marijuana, exercises, clinical trial, and many more. So the first one is medication. Not all patients should give the same prescription because it depending on the taken dosages and also the person need and metabolism. So each person with Parkinson's disease must be individually evaluated by professional to make sure which medicine is the best for them. Next is surgical. As we know, some of the disease that exist need surgery for treat that disease, but not all operation give a successful result. It is because sometimes it may have complication during the surgery. For Parkinson's disease, surgery can be one of the effective treatment options. Besides, marijuana also can use as a medicine for Parkinson's disease, as we know that marijuana is illegalized substances that banned in so many countries including Malaysia, but it's popular in United States and it's been widely legalized for recreational and medicinal purposes. This kind of medicine is used as a treatment for many illnesses and diseases. Even though marijuana itself definitely proof of effectiveness and safety, although it is not approved nationally for medical indication. There are two types of marijuana, which is sativa and indica. And this actually located in brain and peripheral immune system. In sativa contain high quantity of delta-9 tetrahydrocannabinol THC, which is it will produce euphoria, while indica contain more cannabidiol CBD. Both of these types will cross the blood-brain barrier and cause exert neurotropic effect. Next treatment is exercise. Exercising is an essential part of the healthy life. Exercise is more than healthy for people with Parkinson's disease, which is a vital component for maintaining the equilibrium, mobility, activities of the daily living. Exercise can be classified in biking, running, tai chi, yoga, pilates, dance, weight training, and many more. Last but not least is the clinical trials. Before doctor can prescribe patient, they must make sure it will not cause harm to patient. So they must do preclinical trial studies to the disease in order to find the safe treatment to test in people. Clinical study is a study that involves human as a subject. Clinical study classified by two types, which are observational study and clinical trials. Observational study is a study that attempts to understand a relationship between causes and effect, which the study that have different factors that will affect the person. Then clinical trial is a result of the observational study from animal or cell in the preclinical trial, which study medication and medical devices. The treatment for preventing that the disease is still remain a mystery. We have to make sure we stay active and healthy in our daily life. Make sure have a balanced diet in every meal to prevent Parkinson's symptom. That's all from me. Thank you. And I will
So, in conclusion, the disease has not been cured to date, but various treatments have been provided to treat the disease. They can also change their lives for the better in terms of their health and their daily activities. The first non-governmental for the patient have this disease was MPDA, set up on 12 September 1994, and their support group of people with Parkinson and their caregivers in the country. This organization provided educational and emotional support service to people with Parkinson and family members, promote self-management of Parkinson condition with the best medical advice, and to promote awareness of Parkinson disease among the public at large.